Hello guys and welcome back to the channel. In today's video, I'm going to be telling you about 9 signs of ovulation. Yes, so if you enjoy watching this kind of content, consider subscribing to my channel and give this video a big thumbs up as you watch. In this video, I'm going to be explaining these signs, and knowing these signs will help you to prevent pregnancy and also achieve pregnancy. This is because during ovulation, that is the time you release an egg as a woman, and releasing this egg means that when a sperm cell that is healthy comes your way, it will be able to fertilize that egg. So knowing these signs will help to prepare you so that at this time you can choose to be intimate. And also, if you do not want to get pregnant, you're not ready to have a baby, it will also mean that you know these signs and prevent getting intimate at this time, so that you also do not get pregnant. So it's not just for people who are trying to conceive, but also for those who do not want to have a baby at this time. If you enjoy this kind of content, consider subscribing to my channel, because here I talk about fertility, women's health, and everything health. But before we get into it, if you see me for the first time, my name is Peace Tracy. I'm a registered nurse and midwife, and I currently practice with NHS in England. So let's get into it. The first sign we'll be talking about is something that a lot of women do not know about, and that is libido changes. In fact, in many women, when they are ovulating, this is the time they have the highest level of sex drive. Yes, they feel more like having sex compared to other periods in their cycle. And this is in Mother Nature's way of telling or trying to encourage procreation. So if you begin to notice that you have this kind of increased libido at certain times of the month, it could be a sign that you are ovulating at that time. But before you can readily conclude that it is actually ovulation that is causing this, you must have monitored or taken a good record of your cycle length to be sure that it falls within the time you ovulate. So let's get to the second point. And the second point has to do with increased cervical mucus. So at this time, when the woman is ovulating, there is an increased cervical mucus. So you notice that the cervical mucus becomes more slippery, more wetter, and more slimier. So that means that this woman has an increased cervical mucus, and it is a very clear sign of ovulation. The sliminess and quality of this cervical mucus makes it easier for the sperm cells to swim through in order to meet the ovum. That is the egg which has been released during ovulation. So let's talk about the third sign. The third sign of ovulation is changes in your basal body temperature. Now, your basal body temperature simply means the temperature of your body at rest, usually the lowest temperature of your body. So normally at the beginning of your menstrual cycle, your body temperature remains fairly constant. But as you approach ovulation, you will notice a decrease in your body temperature. So now, as you now ovulate, there is immediately an increase in your body temperature. So let me explain. Normally, you have this consistent body temperature. As you approach your ovulation, this temperature drops, and as soon as you ovulate, it rises. So it rises and maintains that sustained rise in temperature. You must have a sustained temperature rise as soon as you ovulate, and this temperature rise could range from between 0.4 to 1 degrees. So this is something that you must experience to show that you are actually ovulating. It is something that you may not feel physically, but taking your basal body temperature is the only way you will find out that there has been a change in your body temperature. To take your basal body temperature, I've explained it in my previous video, but to do this, it is done the first thing in the morning before you get out of bed, eat or drink or do anything else. That is when you take this basal body temperature, and it is taken using a basal body thermometer. So that is it for the third sign of ovulation. Let's talk about the fourth one. Breast tenderness is another sign of ovulation, and this could be as a result of the rush of hormones entering your body before and after ovulation. Also note that you can feel this breast tenderness before ovulation or just after ovulation. Also remember that this breast tenderness can occur in other times of your cycle. Some people experience this during their monthly period. So Take care to notice when you feel this breast tenderness to be sure it is actually happening at the time you are ovulating. Most people do not really experience this symptom. However, some women have reported having breast tenderness during their ovulation. Let's talk about the fifth point. The fifth point is ovulation pain. So when I talk about ovulation pain, I'm just laughing because I remembered something about it. I'm going to give you a quick backstory of this ovulation pain before I explain it. When I was in my teenage years, I used to experience ovulation pain quite often. Not as often as I do right now. Some months I don't experience it, but back then I used to experience it like every single month. So it always comes and goes. And there was a certain time I felt it so much that I had to be taken to the hospital. So when we got to the hospitals, the doctors did their findings, did their palpation, examination, and all of that. At the end of the day, they couldn't say exactly what it was. They were like, maybe you ate something and all of that. It happened another time that we also had to go back to the hospital, and on getting there, they were querying that it could be appendicitis. You know, it really got me worried. And I was wondering why none of them could think about ovulation pain, because I knew they would ask me if I've had this pain before, and I would tell them I, have this pain regularly. But I can't remember if they actually asked me, like, if I get this pain frequently when it comes to it coming every, 4 weeks or 1 month. They didn't ask me in that direction. Possibly they weren't thinking about ovulation pain. But this is something that is real for a lot of women. So if you're experiencing this kind of pain, don't really think so much about it. But if this pain persists for maybe more than 1 or 2 days, it is time for you to see your doctor. Or if the pain is so severe that you really cannot endure it, it's time for you to also see your doctor, because it could be due to endometriosis or ovarian cysts. So when we talk about ovulation pain is a kind of dull pain. Some people also feel it like a sharp pain, usually on one side of the abdomen. So you could feel it on your right or on your left. I've always felt it on both sides. It could be on my right or on my left. And sometimes I feel it on both sides. So people have a lot of misconception. They will tell you, oh, when you're feeling it on both sides, it means you're going to have twins. But anyway, there is no evidence to prove that. So what I'm saying is this: ovulation pain is a very, very common sign among a lot of women when it comes to signs of ovulation. So if you're experiencing this, it's time for you to take advantage of the opportunity to be intimate and get pregnant. Or if you do not want to get pregnant, it's time for you to abstain. So let's get to the next point. The sixth point is heightened senses. Yes, we are talking about the sense of taste and smell. During ovulation, many women have reported an increased sense of taste and smell, that they are able to perceive things more easily, especially when it comes to perceiving some kind of smell and having a high sense of taste. So, I also want to let you know that this is not peculiar to every woman out there. This is based on the reports of most women when it comes to ovulation. So if you're not experiencing this doesn't necessarily mean that you are not ovulating. However, it can occur in some women. So the seventh point is light spotting or discharge. Yes, remember that when we talk about ovulation, it simply means the rupture of a mature egg. So when this mature egg ruptures, it can lead to a small amount of bleeding. So it is normal, and that is why it is called spotting. So it has to be very, very small and not so much for you to go and use a sanitary pad. So when we're talking about light spotting, when there is this rupture of a mature egg, it can lead to a small amount of bleeding. So in this kind of situation, you notice that the vaginal discharge is mixed with a little amount of blood. It could be red or it could be dark brown. So when this rupture occurs, it could take some time for it to calm down and then be discharged through the vagina. And before it gets down there, it could turn dark brown. So if you notice this kind of thing, it's nothing to be worried about. However, If the spotting persists or gets more than is necessary, then at this point, it is important that you speak to your doctor, as this could be a sign of infection or ectopic pregnancy. However, if it is very light or just dark brown and stops in a few days, then it's nothing to be worried about. The penultimate sign is nausea and vomiting. Yes, we are not talking about pregnancy. We are talking about ovulation. Yet, many people, many women still experience nausea and vomiting at the time they are ovulating. This is not a very common symptom. However, it is important to know that some women still experience this kind of signs. And this is possibly due to the change in estrogen and progesterone levels in your body at this time. So it can happen to some women, and in some women, they feel none of that. Let's talk about the last and final point, which has to do with the cervical changes. Remember, we talked about the cervical mucus changes. Now we are talking about the cervix itself. The cervix is that part of your reproductive system which connects the vagina to the womb. So it is just in between the vagina and the womb. Now, this cervix can feel much more softer at the time of ovulation. It can feel just like your lips. When you touch your lips and you are able to feel the cervix, that is just how soft it can be during ovulation. However, after ovulation, it can be as hard as the tip of your nostrils. So, touching your nostrils like this, you can feel the difference between that of touching your lips. You can see that the lips are quite softer compared to the tip of the nose. So that is the difference that occurs. And this can be like the most difficult symptom for them to experience, because it is only when you are able to feel or touch it that you will experience the difference. So that is the end of the video for today. Thank you so much for watching. If you enjoy this, give me a thumbs up. Do not also forget to tell me in the comment section if you've experienced any of these symptoms, or if there are other symptoms you experience which I did not mention in this video. Remember that every woman differs, and what happens to one woman may not happen to the other. So, as I mentioned earlier, all of these signs may not be happening to you at this point, and that doesn't mean you are not ovulating. However, some of these signs are very, very common in a majority of women, and it is something that you could look out for to help you plan whether you really want to get pregnant or not. And so, this point brings me to the end of this video. Do not forget to subscribe to the channel, give this video a big thumbs up if you got value for it, and I'll see you in my next video. Thank you for watching, and bye for now.